Good morning, good evening, everybody. I am Vaidya Asavari Manvikar. I would like to introduce and welcome all of you to GCAR's Global Webinar Research Series. GCAR, Global Council of Ayurveda Research, is an international non-profit organization based out of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all of our resources. No nonprofit can work and operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your skills and your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today, Dr. Dr. Vaijayanti Apte ma'am. She is one of the most experienced Ayurvedic Vaidyas in the US with over 40 years of experience in Ayurvedic practice and teaching. She holds an integrated degree of allopathic and Ayurvedic medicine from Pune University, which she obtained in 1973. Additionally, she holds a master's degree in pharmacology from the University of North Texas. Her sole focus is on providing the best Ayurvedic holistic healthcare by bringing Eastern wisdom and Western knowledge together. She has given numerous talks on Ayurveda in many holistic conferences and IT companies. For the last 15 years, she has hosted a weekly Ayurvedic talk show on an Indian radio channel offering people healthy and preventative tips. Over the last 2 years, as a social service, she offered a free seminar series for seniors titled Golden Health in Golden Years on Zoom. Beginning of next year, she will offer a seminar series, Your Health is in Your Hands, for the youth who are proactive about their health and wellness. For additional information, Ayurvedic healthcare needs, you can contact her at DFW Ayurveda Center, which is based out of Texas. Her number is 469 763 8500. Thank you so much for joining all of us, and thank you, Dr. Jay Apte ma'am. So I will send the baton to you. So
Okay.
speaker.
Thank you, Asavari, for introduction. And thank you, GCAR, for inviting me to speak today. And thanks to all the attendees for taking time to join this morning. Before I start, I always like to start with the prayer. So I want all of you to close your eyes. Take a deep, long breath. With each inhalation, balloon the belly. Each exhalation, pull the belly in. And feel your breath. Observe the movement of your belly. Observe your mind. Mind always flows with the breath. So when the breath becomes rhythmic, mind becomes calm, clear, and peaceful. And now I'll chant the prayer. Sarvepi sukhinas santu, sarve santu niramaya, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ॐ शान्तिः शान्तिः शान्ति। May all be happy. May all be healthy. May all see the goodness in life. May there be no pain or suffering in the universe. May there be peace at the physical level, peace at emotional level, and peace at spiritual level. And keeping this peace within, gently open your eyes and namaste, everybody. Though my talk, the title is the role of Dhatu Pachak herbs in disease management, I'm going to talk about so many things about Agni, the importance of Pachana and all, and then going to talk about Dhatu Pachak herbs and their effect on the body. So we are into this integrative era, and what is the aim of integrative health is mainly offer or promote the optimum health and well-being of the whole person. So it's not only about the physical health, but it is about the physical, emotional, and spiritual health. And that's what Ayurveda has a big role to play in integrative medicine. Also, when it comes to diseases, instead of just taking care of the symptoms, taking care of the root cause of the problem is very important. And that's what we in Ayurveda always do, that we take care of the root of the cause and the symptoms are the effect. So when the cause is gone, the effect wears off and it really takes care of the issue completely. So we will talk all about all this and how the unique Ayurvedic concepts in the treatment play an important role. And for that, I will join my share my presentation with you all. Okay, role of Dhatu Pachak herbs in disease management. And as I said, I'm going to talk about so many things. So it will be a good kind of revision for all of you. So the important concept in Ayurveda is Agni. And Agni is the energy of transformation, conversion, change, digestion, and all that. And what is the definition of health? Conventional medicine talks about absence of disease, but our health is much profound than that. And the Ayurvedic definition of health begins with samadosha and samagnischa. Samadhatu malakriyaha prasanna atma indriya manaha swastha iti abhidhiyate. So you can see how Ayurveda talks about all the levels of our being, and for that samadosha, the balanced doshas, and samagnisha, optimum agni, come in the forefront, because sama agni is only going to produce the strong dhatus, the balanced dhatus in the body, and in the process the malas are produced, they are removed from the body periodically, and then it's not only about the physical body, but your sharp senses, your peaceful mind, and feeling that contentment within. When you have all these, then only we can call it as a swastha. And Agni plays very important role even in our swasthya or in our health and well-being. So Agni, we always say that Agni is at the root level of our health. So think about when we want to grow the plant from the seed, what grows first is the root, and then you see the stems and leaves and flowers and fruits and all later. So the root holds that plant very strongly in the soil, and it absorbs all the nutrients and the water and takes it to the whole plant. So the roots are very important for the health of the plant. Same way, Agni is at the root level of Manushyana. So our health, Agni works like a root. And it says, Shantegno Mriyate, Yukte Chiranjivati Anamayaha. So this Agni, if it becomes weak, if the Agni becomes extinct, it is almost as good as death. But if that Agni is yukta, that is, if the Agni is balanced or optimum, then what it offers? Chiranjiva. That means you will live long, and not only long, your longevity will increase, but anamayaha. So disease free, you will live longer and healthier. And for that, root is very, very important. Then what is the cause of most of the diseases? Also we talk about is Agni. Rogisyat Vikrute Moolam Agni. So in Vikruti also, Agni is the root, but here the Agni is Vikruta Agni. And in health, Agni is the Prakruta Agni or optimum Agni. But Agni is important in health, and Agni also is important in disease state. When we treat, we do the treatment, and what do we call in Ayurveda? Kaya Chikitsa. And Kaya Chikitsa is also mainly is the Agni Chikitsa. So any state of our being, whether it is in health state or disease state or anything, Agni is the most important and crucial concept in Ayurveda. And we always describe there are 13 types of Agnis and all. So Jathara Agni is the main, and Dhatu Agnis. Seven Dhatus have seven Dhatu Agnis, and Panchamahabhutas have Panchamahabhuta Agnis. So 13 Agnis and all. So Jathara Agni is the main. Let me just move this a little bit, so you will see the picture. So Jathara is main, and how do we describe it? Aham Vaishwanaro Bhutva, Praninam Deham Ashrita, Pranapana Samayukta, Pachami Annam Chaturvidam. So I am a universal Agni, and in living beings, I reside in the body around the navel where the Manipura chakra is, and that's where the seat of this Jathara. And along with pranavayu, apanavayu, samanavayu, I digest all sorts of foods. So if I ask you the question, what is it that's not you, but becomes you? So is the food, is the air, is the your thoughts, everything that comes in, it has to go through the Agni Pariksha, or it has to go through this fire, and then only it makes you. All your dhatus and everything is built from the food and the air and the water and the thoughts we take in. So that is very important. Even in yoga, this physical body is called Annamaya Kosha and all. So Anna is important, but digesting that Anna to create dhatus in the body is also very, very important. Then Dhatu Agnis. What is another function of Agni? We call Ayurvarna Bala Swastham Utsaha Upachayo Prabha Oj Tej Agnayascha Pranas Chokta Deha Agni Hetukaha. So this physical body, his physical body made up of what? All the dhatus. Rasa, Rakta, Mausa, Meda, Asthi, Majja, Shukra. And all our life, our life, healthy life depends on what? All the systems functioning well. Systems are made up of all these seven dhatus. And that's what, if you want to live longer, healthier, your dhatus have to be very strong. Your skin tone depends on your rasa dhatu. Your bala, your strength depends on your mamsa dhatu and all. Your swasthya, your health depends on all these dhatus. Your utsaha, your energy depends on rakta dhatu and many. Upachay, your growth, your radiance, your ojas, everything depends on these agnis. And what creates these different dhatus from the Jatara Agni digests all the food and the ahara rasa, and from that ahara rasa, dhatu agnis produce these optimum dhatus on our body, and that helps us to live longer, healthier. And that's why, along with Jataragni and Dhatu Agnis and with Panchamahabhuta Agnis, it creates the person specific dhatus. And you know that everybody's Rakta Dhatu is different, Mamsa Dhatu is different, and all that. That specificity happens because of Panchamahabhuta Agnis work with Dhatu Agnis. So Dhatu Agni, state of Dhatu Agni also is very, very important when it comes to our health or when it also comes to taking care of different diseases. We talk about Agni in Ayurveda, but even in conventional medicine also now they are proving that Agni is so important. So we heard few months ago, Dr. Nitin Kochar, he gave a wonderful, very informative lecture on Ayurveda and cancer and all. And he showed us how the mitochondrial dysfunction is significant factor in development and progression of cancer. He talked about cancer, but even in neurodegenerative diseases, even metabolic syndrome, where it comes to your heart and your stroke and all, when they're combined with to make metabolic syndrome. So in all those cases, mitochondria are very, very important factor. And when they are damaged, they start the process of these diseases. And he also showed us with very lot of experiments that mitochondria and Agni are same. And there is evidence that Agni Dipana and Amapachana herbs also repair mitochondria. So instead of using very expensive treatment to repair mitochondria, this simple Agni Dipana, Amapachana herbs work very well to repair mitochondria and thereby preventing oncogenic or any chronic inflammatory diseases and all. So now the conventional medicine also slowly but surely understanding the importance of Agni. Then there is lot of research is happening on fasting. And in Ayurveda, we call that as a Langan. And Ayurveda has recommended Langan since 5,000 years. And lot of people are doing this intermittent fasting and all to lose weight, to bring their blood sugar into control, to lower their blood pressure, to take care of lot of chronic inflammatory diseases, even to prevent cancer and all. And what does Langan do? Langanaik Shapite Doshe, Deeptegnav Laghave Sati, Swastham Kshutrut Ruchi Pakti Balam Ojascha Jayate. So Langan brings doshas into balance and mainly it does Deeptegnav. So it strengthens Agni and does Amapachana and it creates lightness in the body. It improves your health, it improves your hunger and thirst and improves your digestion, your all overall your strength, your radiance, your immune system, everything depends on this Agni. So you can see how the importance of all these things are happening even in conventional medicine. The step in fasting they call autophagy, that is self-eat, is a natural process by which the cell breaks down old, damaged, and dysfunctional components. And we in Ayurveda, what do we call that? As a amapachana. When the amapachana happens, the the excuse me, the dhatus become strong, and then that starts taking care of a lot of diseases. There is one more thing. This may be new to you, but I want to add something you will learn. Amlakshara Siddhanta. So there was there was Vaidya Datar Shastriji, Atmaram Datar Shastriji, and he developed Panchabhautik Chikitsa. So generally in Ayurveda, we stop at dosha level. If disease is happening because of Vata dosha or Pitta dosha or Kapha dosha, but he went even deeper into Ayurveda and he said if it is kapha condition, but whether the kapha is made up of earth and water element. So which Panchamahabhuta as causing the pathology? You have to go and check that Panchamahabhuta and then treat accordingly. If the Pitta is the problem, whether there is Agni element is increased or Jala Apa element is increased in that to increase Pitta dosha and all that. So it takes all this Panchabhautik Chikitsa really takes you deeper into that. And if you get hold of Data Shastriji's books and all, I would strongly recommend to read all these books that really, really will help you, and it has helped me in my practice. And he has created one concept called Amla Kshara Siddhanta, based on only one line sutra from Madate Chikitsa, and that helps us tremendously, especially in these days. We talk so much about chronic inflammatory diseases and all. And what is that sutra in Madate Chikitsa? It's Ksharo hi ati madhuryam shigram amlopasamhita. That means excess amlata is neutralized by kshara dravyas. And this experiment, if you remember, in our science college, we did the experiment. In the hydrochloric acid, we added sodium hydroxide, and at one point it became neutral. The same way, to maintain the balance, if there is excess amlata, we have to use kshara dravyas. If there is excess ksharata in the body, we can use amla dharmi dravyas. So is to create the balance between the two, whichever is increased. With this one line sutra, he has created the whole concept. Now, the Panchamahabhutas, because he always goes to Panchabhautik level, he talks about Panchamahabhutas of Amla and Kshara Dravyas. And he mentioned that in Amla Dharmi Dravyas, the first element is Jala or Apa, then Agni, then Prithvi, Vayu, and finally Akash. But in Kshara Dharmi Dravyas, you will see the fire is the main element and water is the least element. And that's why Kshara Dharmi Dravyas work as a Pachana. Even in Pachaka Pitta, what do we talk about? Pachaka Pitta is Tyakta Dravatva. That means there is least amount of water. It is very, very fiery. So when there is excess amlata, we use this Kshara Dharmi Dravyas. And another example of that, in Ayurveda, we call, here in US, millions of people have hyperacidity or GERD and all that. Its Ayurvedic name is Amla Pitta. That means the amlata is increased. So when we always say amlata is increased, that means pitta is increased. So you should stay away from all the pitta aggravating foods and all. But here in amla kshara dravyas, it is telling you to use a kshara dravyas to balance that amlata in the body. And that's why a lot of people are surprised that why ginger helps in um, uh, amla pitta. And ginger being very kshara, it is fiery in nature and it balances the excess water element in amla pitta, and people start feeling better. So when you start understanding this concept, it will really help you in your practice a lot. So in kshara dharmi dravyas, fire is the main element and jala is the least element. And in Amla Dharmi Dravyas, water and fire, Jala and Agni are main elements. So the Amla and Kshara, you may think that Amla, that is the sour in taste, and Kshara is salty in taste. So it's not only the taste, but the effect of that sour amla dharmi dravyas or kshara dharmi dravyas on the body. In Ayurveda, we generally call as a vipaka, the effect of those after digestion. And that's what here we mean, that kshara dharmi dravyas mainly do digest, they digest ama and have scraping action. So when in Ayurveda we call santarpanotha vyadhi and apatarpanotha vyadhi. So santarpanotha vyadhi, this pachana earth, the kshara dravyas help tremendously. And that's what even when we talk about Dhatu Pachak, so we will see how those digest ama and improve our health. Even in conventional medicine, they're talking about the same thing. You will hear a lot of chronic diseases are happening because of acidic foods. But this and alkaline foods, alkaline fruits and vegetables are beneficial to balance excess acidity in the body. But remember, it's not that the taste of the food or the pH of the food that determines it is acidic or alkaline. Because lemon is acidic, but still it works as an alkaline on the body. Apple cider vinegar is tremendously sour in taste, but it works, its effect on the body is like an alkaline. So it is not the taste or the pH that determine the acidic or alkaline food, but its effect of those foods after digestion. And they call it as a pral. Pral is potential renal acid load. It is the measure of potential acidity of the foods after metabolism. And that's why the positive pral value indicates acidic foods and negative pral values indicate alkaline foods. So oranges, lemons are very sour in taste, but their pral value is negative 2.7 or 2.6, and that's why even they work in excess when there is excessively amlata in the body or in ama system, ama in the body. Salmon doesn't taste very sour, but its effect on the body is acidic. So many of the meats, chicken and red meat and all, their effect on the body is very acidic because their pral value is positive. I earlier mentioned about the apple cider vinegar, and it is used a lot in chronic inflammatory diseases because though it is sour in taste, but its pral value is negative 1.5, and that's why it is beneficial in many of the diseases. So you can see even conventional medicine also is proving Ayurvedic concepts. So always stick with your Ayurvedic concepts, have them clear in your mind, because in this ever changing world all Ayurvedic concepts are never changing. Now Dhatu Pachak herbs. In Ashtanga Hriday, in Dhatugata Jvara Chikitsa, there are Pancha Kashayas are described at different dhatu levels. They're treating the jvara in that dhatu level. But these kashayas are not only limited to jvara chikitsa, but you can use all these herbal combinations to do amapachana, to cleanse all dhatus and rejuvenate the body and treat different diseases. So you can make a use, literally Vaidyadata Shastriji mentioned that all these panchakashayas, when you use at different dhatu level, they really work like a amrut. In case of chronic, and I use these formulas a lot also in chronic inflammatory diseases, and they really give excellent results. And you all have to know about these Dhatu Pachak herbs. And I told you, Pachana is the mainly the Ksharata when there is Santarpana, when there is lot of Ama, when there is lot of Amlata in the body. We have to use all the Pachak herbs. And these Dhatu Pachak herbs even disease process is happening, what doshas aggravate, and whenever there is a kavaigunya, the weakness in the dhatu, and that's where doshas lodge and create the disease process. So if you want to just heal all those tissues and take care of all the kavaigunya and all, these dhatu pachak herbs will help you a lot. So these five kashayas are for rasadhatu. It says kalingaka patolasya patram katukarohini, and that means kalingak means indraya, patol, patram means neem, and katukarohini is kutki. All this combination is works very well for rasadhatu. Then for rakta dhatu, patol, sariva or ananta, musta is nagarmotha, patha, and katukarohini again it is kutki. For Mausa dhatu, it is patol, neem, trifala, mrudvika, that is the red raisins or black raisins, manuka in Marathi we call, musta, that is nagarmotha, and vatsaka, that is kutaja. For Medha dhatu, kiratatikta amruta, chandanam, vishwabheshajam. So kirayata, in Marathi we call kade chirai. Amruta, that is Guduchi or Giloy, Chandan, and Vishwabheshajam is ginger. So this formula works so well for Medha Dhatu, strengthening Agni and related diseases. And for Asthi Dhatu and Majja Dhatu, Dhatri, Musta and Amruta. Dhatri is Amalaki, Musta is Nagarmutha, and Amruta again is Guduchi. So these combinations, and they are 100% herbal, so you can use very safely in US. You don't have to worry about there are no metals, no ashes, no nothing in it, and they work very, very well at different dhatu levels. This table also is very, very important. I just wanted to give you the overview about this physical body is made up of all the dhatus and upadhatus. So rasa dhatu, that is the fluids in the body, plasma, lymph, serum and all. And upadhatu is tanya, and also rajam, menstrual fluid. So what is the function of rasadhatu? Is prinana, is the nourishment. So stanya, the breast milk is going to nourish the fetus, the newborn babies. And the raja, menstrual fluid. Why is it upadhatu of rasadhatu? You may be wondering. But raja is really the endometrium which nourishes the fetus. So you can see how deep Ayurveda goes. Even at the fetal state, it needs the nourishment to grow, and that nourishment is given from the raja, and that is the part of rasadhatu. And that menstrual fluid, when the conception does not happen, all that endometrium that we see as a menstrual fluid during the period, but its main function is to nourish the fetus. Very, very important. Then its kapha is mala. Like right now, I have congestion, fall, congestion and all. That is excess kapha. And what is the srotas where the rasadhatu is produced? Is Hruday and Dashadhamanis. So remember all these dhatus, upadhatus, its malas, srotas and all that. So anywhere you see the pathology, these herbal combinations work very well at all these diseases, in disease conditions to improve the health of that dhatu and thereby taking care of the disease. Then Rakta Dhatu, that is the red blood cells and the blood, its Upadhatu is Kandana and Sira, blood vessels and tendons. Mala is Pitta, and its Srotas origin is Yakruta and Pliha. That is, it is Rakta Dhatu Ayurvedically is produced in liver and it is stored in spleen. Then Mamsa Dhatu, the muscle tissue in the body, wherever that gives us the strength to do anything in life, our Mamsa Dhatu has to be very strong. So Vasa, subcutaneous fat or the twak, the skin. It's the mala is the mala is the secretions from all the natural orifices. So the secretions in all these orifices are very important. Our nose also is that moist secretion in our ears and our throat and everything, wherever there is the opening, and it has to have the lubrication so it functions very well. And is produces at the twak, ligasnayu, and twak is the origin of the mamsa dhatu. Then the meda dhatu is the fat. Everybody says that stay away from fat, but Ayurvedically, having good quality fat on the body and in our diet also, like a ghee and natural oils, is very, very important, because the meda dhatu keeps all the systems functioning well. Our body needs to be lubricated well, all the systems. Like our car, we change the oil in the car so car can run smoothly. Same way, if your body has to run smoothly, there has to be the optimum meda dhatu on the body. So all the, and upadhatu is ligaments. And why am I giving you these tables? Because we see a lot of health issues like ligament tear. Where will you go? You will use some of the healing herbs, but along with it, if you use the Dhatu Pachak herbs, those ligaments will heal better. Sweda, mala is Sweda, and always remember, when people become obese, they start sweating more and they always complain that my sweat has a bad odor. So when somebody is complaining about that bad odor and all, always remember it is the mala of the Meda Dhatu. Meda Dhatu is not very healthy. So I need to give him Meda Dhatu Agni or Meda Dhatu Pachak herbs. So it will get into balance. And the Srotas is the kidneys and omentum. That's where the Meda Dhatu is produced. Then Asthi Dhatu. Asthi Dhatu, we all know that bones are have to be very strong. Otherwise, osteoporosis, osteopenia, then the bones will break, the joint, they will have the joint issues and all that. So, Asthi Dhatu has to be very strong. Is Upadhatu is Danta, that is the teeth. So, always remember, and our teeth, our nails, our hair is all part of the bone. So, when somebody complaining about teeth, somebody complaining about falling hair, somebody complains about chapped nails, brittle nails, and all that you have to think about. It is part of Asthi Dhatu. So I need to strengthen Asthi Dhatu Agni and all that. Then Majja Dhatu, bone marrow. It also, there is a debate between the head hair is, sometimes it is called body hair is the mala of Asthi Dhatu and Majja Dhatu is the head hair. And oily secretions in the eyes and skin and feces is the mala, and it is produced at the Asthi and Sandhi level. And Shukra Dhatu, reproductive system. But also remember, Shukra Dhatu also is our immune system. And Ayurveda has described as this Sarvangagata Shukra Dhatu, that is our immune system. That is also very important. So this table will help you a lot to know the dhatus and upadhatus, how our body is developed and what level you have to use this different dhatu, pachak, herbs and all that. So let me go a little bit into detail that Rasa Dhatu Pachak herbs. Again, I mentioned Kalingaka Patolasya Patram Katuka Rohini, Indrayav, Patol, Neem and Kutki. So these herbs mainly have which Mahabhuta is Akasha, Agni and Vayu Mahabhuta. So you can see all these elements are very subtle. So when there is, and Neem also has Akasha and Vayu Mahabhuta. So these elements are settled. There is no Prithvi Mahabhuta or Apa or Jala Mahabhuta. And that's what when there is excess amount of this formula can be used in many conditions related to Rasa Dushti due to Kapha dosha or Pitta dosha. So I told you whenever there is a congestion, you can use in respiratory system, in cardiac system or any system. When there is congestion, there is excess ama, you can use this Rasa Pachak herbs. When there is lot of swelling on the body, you can use this Rasa Pachak herbs and all. Then I also mentioned to you about Stanya and Raja are also Upadhatu of Rasadhatu. So many times young women with new mothers and all will come to you and you have to, they maybe want to breastfeed their baby or there may be some issues in lactation and all that. In all conditions, you always think about it is the upadhatu of rasadhatu, and that's why these rasapachak herbs along with other herbs, I'm not saying only give these pachak herbs, but along with other herbs, you always give these different pachak herbs at that dhatu level and will also help you a lot. Even menstruation, women have a lot of problem these days. You hear so many cases of endometriosis or menorrhagia, excessive bleeding, amenorrhea, oligomenorrhea, and all those kind of things. So this also menstruation, it is all related to endometrium. It is related to upadhatu of rasadhatu. Let me give you one excellent clinical study in this. I had one woman and she wanted to get pregnant and she was diagnosed with stage 4 endometriosis. And they said either you have to do hysterectomy, remove. She said, no, I want to have children. And she went for IVF and all, but she tried 2-3 times, but it didn't work. So finally she came to me and I just saw all these conditions in her. Her pitta ama had aggravated a lot. So I gave her different herbs, but main herb I gave her was Rasa Pachak herb. And to her surprise, and even to her doctor's surprise, she got pregnant within 2 3 months. So that is a good kind of evidence-based clinical study in Ayurveda. And once you start using these herbs, you will really start seeing so many benefits of using these Dhatu Pachak herbs. Even in diabetes, Ayurveda has described prameha in 20 different types. But when kafaja prameha, especially it says bahudrava shleshma, dosha vishesha, when there is excessive apa element, more moisture in the body, excessive shleshma, that is kapha in the body. And in that case, this rasapachak herb work very well. So I'm giving you only few examples, but it's not only limited to these conditions, but you, as you start thinking about it, when you are going to diagnose any condition, think about which dhatu is involved in pathology and whether it is santarpanotha or it is apatarpanotha vyadhi. And if it is santarpanotha vyadhi, you definitely can use all these pachak herbs with great success. Then rakta pachak herbs. Rakta patolam sariva musta patha katuka rohini. Patol sariva, that is ananta, musta is nagarmotha, patha and kutki. Again, all these herbs have akasha, vayu and agni mahabhuta. So in santarpanotha vyadhi, what happens? There is more jala and prithvi element. But in all these herbs, mainly there is Sariva and Musna also have Prithvi element, but they also have these Akasha, Vayu and Agni elements also. And that's why it just helps you to cleanse the blood. This formula is very helpful in Rakta Dushti due to excess pitta kapha and many case skin issues like acne. A lot of teenage kids will come to you and having acne and they have used lot of allopathic treatment and antibiotics for years and years. In Ayurveda, you will use different herbs, but if you use Rakta Pachak herbs in these cases, you will really see good results. In hives, in hives also, the pitta has gone in wrong directions and it causing big blotches of pitta all over the body. You may feel that, oh, pitta is aggravated. How can I use all these pachak herbs? But in that pitta, it creates hives because it has gone in Ayurveda, we call as a Vimarga Gaman. So because of the blockage and all these bitter herbs which have Akasha, Vayu, Agni element, just remove that blockage, then pitta goes its in original position and you can treat all these hives in those cases. Even in psoriasis, conventional medicine has diagnosed it as an autoimmune disease and they give lot of immunosuppressive drugs and all, but there are so tremendous side effects also. So I always recommend you think about your Ayurvedic pathology and Ayurvedic samprapti and then diagnose it. And at one conference, I remember somebody asked that I had a psoriatic patient, but he says that when he goes swimming in the ocean, his skin gets bitter. And what could be the reason of that? This Amlakshara Siddhanta is is an excellent example of this because ocean water is very salty. That is, there is lot of ksharas. And psoriasis Ayurvedically is mainly excessive amlata at different dhatu levels. And when the kshara touches his skin starts feeling better. So you really have to diagnose the diseases because of excessive amlata or ksharata and use it. But in those cases also, I use lot of Rakta Pachak herbs and really get good results. Then in any conditions related to liver and spleen, not necessarily every time it's very like liver cirrhosis, but many times liver is not functioning well. Maybe sometimes there is enlarged spleen and all these. This is the origin of Rakta Dhatu. And that's what any conditions related to liver and spleen. You can also add along, I'm saying with along other herbs, but use these Rakta Pachak herbs a lot. Any condition that causes pus formation or abscess in the body, small boils or blisters, I mentioned about acne and all that. In all those conditions, Rakta Pachak herbs work very, very well. Then Mamsa Pachak earth. Patolam Nimba Trifala Mrudvika Musta Vatsakaha. Patol, neem, trifala, black raisins, musta, and kutaja. So in Triphala has Agni, Vayu, Akash and Prithvi element, and Amla and Bheda also has Akash and Prithvi and Vayu element. If you remember the table earlier, I mentioned that in Kshara Dharmi Dravyas, first is Agni and then is Prithvi, then is Vayu and Akasha and all that. So even there is little Prithvi in that, but it still absorbs lot of fluids in the body and helps to make the muscles very, very strong. So any condition related to muscle, you will have like muscular tear or ligament tear or the muscle sprain or stiffness, frozen shoulder. In any of these conditions, you can use the Mamsa Dhatu Pachak herbs. Even in fibroids, Vaidyanatha Shastri had given so many examples that fibroid is also the growth at the uterine level and is the related to the mamsa dhatu. So if there are small fibroids, if it is big like tennis ball size and all, I'm not talking about that, but when there are small fibroids or the earlier stage, if you want to take care of that, these mamsa pachak herbs work very well. These days lot of people, especially senior people, men, have problem with enlarged prostate and they have to get up at night frequently to urinate. Because of the enlarged prostate, they cannot completely empty their bladder, and that's why they have to get up at night frequent times and all that. So along with kanchanar and all, I use this mamsa pachak herbs in that case, because it brings the mamsa dhatu into balanced state. And excessive growth of dhatus, you always remember that when the agni is weak, the quantity of dhatu is increased but the quality is decreased. So we see when there is enlargement of some of these mamsa dhatu, agni pachak, mamsa pachak herbs will balance it, and that will help in any kind of muscular growth. Even varicose veins, why mamsa pachak herbs will help? Because the muscle of the veins, the mamsa dhatu of the veins has become weak, and that's why they become varicose. So to strengthen the walls of the veins, Mamsa Pachak herbs work very well. So I'm giving you different examples of that. Always remember, it is not only limited to these things, but you always think about what pathology is involved, which dhatu is involved, and which herbal formula, which dhatu pachak herb you will be able to use. Then Medo Pachak herb. Kirata, very, very bitter. Amrita, Guduchi, sandalwood, and ginger. Ginger has Agni and Vayu element. Guduchi has Agni, Akasha, and Prithvi element. And Kirata and sandalwood has Akasha and Vayu element. So all these are the Pachan Dravyas and they work very well in different conditions, especially weight gain. And because of a diet, sedentary lifestyle and wrong diet and all, lot of people have this weight issue. Whenever you see weight issue and all, you always have to think about these Medo Pachak herbs. They work so well in so many of my clients having all these issues. I use Medo Pachak herbs a lot. Then there is a lot of water retention and swelling. So in water retention also you can use Rasa Pachak herbs. But if it is because of excessive obesity and you see the swelling on the body and blockage and all that, then definitely you can use this Medo Pachak herbs, Kiratatik. And remember, all these formulas are available. So you don't have to worry about where to find individual herbs. All these formulas are available as Medo Pachak, Mamsa Pachak, and all that. Then ligament injury, because ligaments is also the upadhatu of Meda Dhatu. And that's what a lot of ligament tear, ligament injuries, plantar fasciitis, many of these kind of conditions you can think Ayurvedically. Lot of people have these lipomas. They have some cell growth and they are very benign. They do not hurt at all, but they just grow on the body. They are benign lipomas. Even in those conditions, and I had treated couple of my patients with these Medopachak herbs and they really got good results. They call me like after like 10 years, he said, Dr. Apte, I felt so much better. But again, I stopped taking herbs and after like few years, I'm seeing all these again. So I need your herbs. So always think about these herbs in different conditions. Then kidney issues, because kidney is the and omentum is the origin of Meda Dhatu, and that's what many kidney issues. These days, there are a lot of people having chronic kidney disease and all that. So you have to use many different herbs depending on each prakriti, each client, and all that. But when you include also Medopachak herbs, you will really start seeing good results with that. Then Asthi, Majja, Pachak herbs. When it comes to old age, people, everybody is worried about osteoporosis, osteopenia, and we focus only on taking calcium. But if you just take calcium or different calcium supplements, body has to absorb that calcium very well. And for that, your the asthi dhatu agni have to be very strong. And the herbs for that is amlaki, musta, and guduchi. And this formula is good for both asthi pachak and majja pachak. So even many neurological symptoms also you can use this formula very safely. Again, all these three herbs have Prithvi, Agni, Vayu, and Akasha element in that. So bone related issues, osteoarthritis or degenerative spine disorder, or somebody has the slip disc, somebody has sciatic problem or arthritis and all that. I use many times this formula. Then hair loss. I have good hair formula, but along with it, I recommend this Asthi Pachak herb because it wants to strengthen those agnis to create the healthy hair. Chipped nails, teeth related issues, and all. You never might have thought about treating these conditions with Asthi Madhya Pachak herbs. But that table I gave you, Dhatu, Upadhatu, Malas, and Srotas and all, that comes very, very handy. So you can connect all these dots and use different Dhatu Pachak herbs. Even tinnitus discharge through the ears and all. Tinnitus is kind of ringing in the ears. So we always Ayurvedically recommend to put 5 to 10 drops of sesame oil in the ears and all to lubricate ear canal. But to take care of it from inside, if you give asthi or majja pachak herb, that will help a lot. Because in hearing, which Mahabhuta is involved is Akasha Mahabhuta related to our hearing. So when to balance that, when we use these herbs, when there is excessive discharge or any imbalance, this formula work very, very well. Then many neuralgia also because it is related to Majja Dhatu also. So you can use in some of these conditions. So it's not only some conditions, but even in chronic inflammatory diseases like IBS, Crohn's, psoriasis, RA, and all, they are all diagnosed as autoimmune. But remember, even the researchers say that we always think that our immune system is involved in chronic inflammatory diseases, but actual cause of chronic inflammatory diseases is not known. And in Ayurvedically, and I think many senior Ayurvedic practitioners believe me that in many cases we see all these conditions happening because of excess ama and weak agni. And that's what when I treat many of these conditions with different herbs and these dhatu pachak herbs, and I get really good results. Even in RA, RA is 100% they always call autoimmune disease. But what is the Ayurvedic name for RA? That is rheumatoid arthritis. Amavata. So because of ama, vata is blocked. And that's what it gives lot of swelling and pain and all that. So you need to take care of that ama. So you can use ama pachakwati. But along with that, if you use asthi pachak herb, you will really kind take care of many of the symptoms related to RA. Even sometimes there is a history of parasites. I use Medopachak herb. You may be surprised. But when there is excess ama buildup, when there is excess amlata in the body, and all the parasites, Parasites are not only worms, but even excessive bacterial growth and all in the body. When that happens, I use Medopachak herbs with great success. So here I just wanted to give you different examples of different Dhatu Pachak herbs and all. And again, I want to tell you that these Dhatu Pachak formulas are available in the pill form and all that. So what you have to remember is always diagnose any disease Ayurvedically. Do not kind of cloud your mind. Okay, this is autoimmune disease. So what should I do Ayurvedically? No, you always have to think about which dosha is involved, what dhatu is involved, what is the state of the Agni and all that. So you will come to the right conclusion. In many Santarpona Vyadis, this Pachak herb is the right treatment. Amapachana and Dhatu Pachana herbs also work very well. See which Dhatu is involved in the disease process and use that particular Dhatu Pachak herb along with other herbs. So Dhatu Pachak herb fine tune your treatment by targeting particular dhatus. That's what Asavari was also saying, that we always call in Ayurveda dhatu gatatva, which dhatu the pathology is happening, where there is the vaigunya and all that. So once you see that, and if you use this dhatu pachak herb, you will be very successful. Because finally, what we have to always remember, Agni Moolam Manushyana and Tada Agnim Sada Rakshet. So we always have to protect our Agni. And if we can do that, we can live healthy, happy, and long life. Okay, this is what I wanted to share with all of you. And this is just my information. Asavari also gave you my phone number and all. So if you want to contact me, you can send me the email or call me. Thank you so much. Now I will stop my presentation.
Thank you so much for such a beautiful presentation. Very, very insightful.
Thank you
Absolutely
so
amazing.
much.
Thank
Does
you.
anybody have any question? Looks like everybody is very expert. So
No, it was really, really wonderful. Yeah.
okay.
Dr.
Thank you
Aarti has
so
some
much.
question. Okay. Dr. Aarti, you can unmute yourself.
Yeah, Madam, thank you for the wonderful presentation. I have a question.
Yeah.
I very well aware and I have experienced that for Santarpanotha Vyadi, these Dhatu Pachak Dravyas, they work very well.
Yes.
But what about Apatarpanotha Vyadi?
Yes, and Apatarpanotha Vyadi, and that's what that Amlakshara Siddhanta works very well. Apatarpanotha Vyadi, there is lot of Dhatukshay, and that's what you have to increase the Amladharmi Dravyas in the body. And that's why Vaidyadhata Shastri has one Rajani Yog formula. And it works like a miracle. Let me give you just example of like few days ago, I saw one lady and she had big cracks on her feet. And when I took the history and took her pulse and all, her amlata in the pitta dhatu has increased a lot. And she said, my feet and hands are becoming they burn a lot. There is a lot of heat in that. So I sent her this Rajani Yog formula, and I also gave her, Dr. Data Shastri has created Nisha Tel that is made with turmeric, because they said the vipak of turmeric, its effect on the body is amladharmi. So when there is excessive ksharata, and you will see the patients with who have gone through radiation and chemo and all, they have tremendous heat in the body. So in that case, you use amladharmi dravyas and they work very well. Another case, I had one chef and he said, I'm always in front of the fire and my body is on fire. My eyes become blood red. I never drink, but still my eyes are very sensitive to heat and they become blood red very easily and all. What should I do? So in that case, I use Amla Dharmi Dravyas. Amla is a good example of that, increasing amlata in the body. And also this, I gave this formula called Rajani Yoga, or there is one formula called Paripathadi and all. And when you use those formulas, then Amla Dharma increases and you can take care of this apatarpanotha vyadhi a lot. It's a
Thank
good
you,
question,
madam.
Arti.
Yeah, thank you, madam.
And you are in India, so read all Vaidyadata Shastriji's books. It will teach you a lot.
Yeah, thank you, madam. Yes, unfortunately, I left them in US.
Okay.
Yeah, but that Amlakshar Siddhanta is absolutely wonderful.
Yeah.
It's so useful in day-to-day practice.
Yes. Yes, it does.
Yeah. Okay, anybody else?
I had a question. This is Dr. Renee.
Sure.
If somebody has had a mental trauma or physical injury and those dhatus are blocked and there's a lot of ama and toxins in there, do you want to first clean those and the agni is low before we start putting out the herbs for simulation? And what would you then recommend?
Yeah, in those case also the subtle Dhatu Pachak herbs will help, and in that case that because it is also related to Asthi and Majja Dhatu, you can use that Amruta, Guduchi and Guduchi, Amruta and Musta. That formula will work very well to take care of ama at the emotional state.
So you take it like for 2 months and then start
That
doing.
depends on each condition.
Yeah, right.
Depends on each patient.
Okay. Right, thank you.
Yeah. And I want you to start thinking in this direction, okay? Because only don't stop at the which the dosha is aggravated. Also think about which dhatu is affected because of that. And then you will be able to connect the dots and come to the right conclusion for the treatment and which herbs to use and all that. And I also, in my practice, I use individual herbs. I have few hundred herbs in my office and I make special formula for each client. So it works very well. It's not like I use the standard formulas. So that gives me the flexibility of using multiple herbs.
Yeah, absolutely. That makes complete sense.
Yeah.
I had really wonderful result with Rasa Pachak in
Yeah.
so lymphedema. This woman was having lymphedema for many
Yeah.
years. Was not
Yeah.
able to find any solution for that.
So
Yeah.
lymphedema asla तर definitely use Rasapachak herbs. They work very well in that case.
Correct.
Yeah.
Absolutely.
Yeah.
All right. So,
Okay.
yep. So thank you again. Thank you so much, Dr. Jayapte ma'am. It was wonderful. It's very, very informative, very valuable. It will be helpful for everybody.
Yeah.
And you explain all the critical concepts of Ayurveda, their relationship with conventional medicine,
Yeah.
very effectively with examples as well. And also that Amlakshara Siddhanta and going beyond doshas, because
Exactly. Going beyond doshas
that's
also is
really,
very,
really
very
important.
important. Yes.
Right.
Because in Pitta, we always say Pitta is aggravated. But which element of Pitta is aggravated? If there is more Apa element, the water element is aggravated, naturally the fire is going to be weak. Right? And there will be a lot of Ama in the system. If there is excessive fire increase, it will burn your dhatus and all that. So going deeper into Panchamahabhuta level also helps a lot.
Absolutely.
Yeah.
It's on a very minute level.
Mhm.
Yep. All right. So thank
Okay,
you
thank
again
you
for
so much.
sharing all
Thank
your
you so much,
experience.
Asavari and G Kar and all of you who attended.
Yes, absolutely.
Okay.
So please like, comment, and share our videos. And once again, I would like to invite everybody to become member and also fill out our volunteer form if you are interested into volunteering. And you can also subscribe IU update newsletter. Stay tuned with our projects and events. If you have any questions, feel free. You can contact us Ayurveda Research USA at gmail.com, or you can also email me asavari@mnayurveda.com.
Okay. Have a good day, everybody.
Yep. Thank
Sure.
you.
Bye.
Bye bye. Thank you so much.